could a high-tech new treatment help cure opioid addiction? Our next guest's son, Jordan, got hooked on opiates after taking painkillers for a back injury. Eventually, a heroin habit developed, and Jordan started using counterfeit money to pay for it. But instead of getting jail time, a doctor sentenced him to treatment. And that's when his mom saw an opportunity to try an implant that kills the craving for opioids, combined with a unique recovery program to help addicts kick their habit. Now, joining me now is Jordan's mom, Angie Denes, and Brady Granier, a nurse and CEO of BioCorRx, the company behind this very interesting treatment. Welcome to you both. Happy New Year. First of all, tell us how your son is doing right now.
Amazing. I mean, he's back to his old self. He's got a sparkle in his eye again.
Okay, and so he got addicted by painkillers. Before we get into the treatment, which I know everyone wants to hear about, I want to talk very briefly about with you about how parents and patients can get addicted to these painkillers and why hospitals are prescribing them when they know, or at least at the levels they're prescribing, when they know that this can cause this kind of addiction.
Well, back when Jordan first sustained his original injury, we didn't know back then. I mean, I could see it because I worked in the hospitals, and I was concerned that they were going to get him addicted to the opioids. And they just acted like, you know, we'll cross that bridge when we get to it. Wow. But when we got to it, there was no help.
Right, this is like every parent's nightmare. Brady, tell us about this cure and this idea that you can have this implant and somehow have that help you with the addiction. Because we know that there is just treatment is very expensive these days.
Yeah, let's be clear. This is not a cure. There is no cure for addiction. But this is a very effective tool that can block those cravings and protect people from actually overdosing. So once this naltrexone implant is in their system, it can prevent them from overdosing if they do use. Of course, they can always try to overcome that blockade. But let's be clear, it's not a cure. It's a tool that will give someone a window of opportunity to get into recovery programs and cognitive behavioral therapy, 12-step, whatever they want to be in. I mean, the more the merrier. So this implant will afford them several months of that opportunity to get their lives back on track. And that's what we've developed with the BioCorRx recovery program. It's a really unique, we're a unique company with a unique program, and but it does require a lot of hands-on.
What does it cost?
Well, it's in the several thousands of dollars, not the tens of thousands. It's less than going away for 30 days in rehab. Wow. So cost is an issue which we need to address. Actually, this care should be relatively free or with no upfront out-of-pocket. That's a big issue in the treatment of addiction. It's unlike any other disease process where sometimes, you know, access to care is a problem in itself, but you have small windows of opportunity to actually get help for people when they're ready, and oftentimes cost can be used as a barrier to treatment. It's an excuse, no matter what the cost may be. So we really need to focus on making this care available for low cost or none at all.
Angie, how has your son responded to this treatment?
He's done very well. We've been very hopeful. We realize that this isn't, you know, a cure-all. As Brady said, it's a tool. But it's given him opportunities to just focus on his life. I don't have to worry as the day that he relapses, and he can just move forward. So we're really grateful for that. But we want this opportunity for everyone in the United States that's developed an addiction, and it should be made affordable.
Yeah, Brady, tell us how this can help with this opioid crisis that our country is going through right now.
Well, again, as I said earlier, it can block those cravings. It can give people a window of opportunity to get their lives together like Jordan. I mean, he's a great story. We need more Jordans. In 2015, $500 billion was spent on the what was the cost to society of the opioid crisis. That's a huge number. So we need to cut that number down. We need to make an investment in that. If we can get people help and get them back as productive members of society, like Jordan, now they're contributing to the system as opposed to costing the system. So we really need to look at this in a different way. And we need more time spent on uncovering those treatments that are out, those evidence-based treatments that are out there, like ours and others. There's really good treatments out there.
Absolutely.
It needs more attention.
Well, thank you, Brady. Thank you, Angie, for sharing your story. Well, we wish the best to your son, Jordan, and we hope that others who are facing, other families that are facing this, are tuning in and see this potentially as an option for them. So thank you so much, and Happy New Year to you both.